What is ADHD, Attention Deficit Hyperactivity Disorder? Attention Deficit Hyperactivity Disorder, commonly known as ADHD, is a neurodevelopmental disorder that affects a person's ability to pay attention, control impulsive behaviors, and regulate hyperactivity. It is estimated to affect around 5 to 10% of children worldwide, and about 4% of adults. ADHD is characterized by three main symptoms: inattention, hyperactivity, and impulsivity. Inattention is the inability to focus and stay on task, easily distracted, forgetful, and frequently makes careless mistakes. Hyperactivity is excessive motor activity, such as constant fidgeting or restlessness, difficulty staying seated, and feeling the need to move constantly. Impulsivity is acting without thinking first, such as interrupting others or blurting out inappropriate comments. ADHD can be classified into three types: predominantly inattentive type, predominantly hyperactive impulsive type, and combined type. Predominantly inattentive type is characterized by primarily experiencing symptoms of inattention. Predominantly hyperactive impulsive type is characterized by primarily experiencing symptoms of hyperactivity and impulsivity. The combined type is the most common type and is characterized by experiencing symptoms of both inattention and hyperactivity impulsivity. ADHD is usually diagnosed in childhood, and symptoms can be observed as early as preschool. The exact cause of ADHD is not yet known, but researchers have identified several potential factors that contribute to the disorder, such as genetics, environmental factors, and brain structure and function. Research has shown that genetics plays a significant role in ADHD. Studies have found that the disorder tends to run in families, and there is a high degree of heritability. Environmental factors can also contribute to the disorder, such as exposure to toxins or infections during pregnancy and early childhood. Brain imaging studies have shown that people with ADHD have structural and functional differences in certain parts of the brain. These differences are most prominent in the prefrontal cortex, which is responsible for executive functions such as attention, planning, and decision-making. ADHD can have a significant impact on a person's life. Children with ADHD often struggle academically, socially, and emotionally. They may have difficulty with organization, time management, and completing tasks. Adults with ADHD may struggle with maintaining employment, relationships, and managing daily responsibilities. Treatment for ADHD typically involves a combination of medication, therapy, and behavioral interventions. Stimulant medications, such as Ritalin and Adderall, are the most common type of medication used to treat ADHD. These medications work by increasing dopamine and norepinephrine levels in the brain, which can improve attention and reduce hyperactivity and impulsivity. Behavioral interventions are also an essential part of ADHD treatment. These interventions focus on teaching individuals with ADHD strategies to improve their attention, organization, time management, and social skills. Cognitive behavioral therapy, CBT, is often used to teach individuals with ADHD strategies for managing their symptoms and developing coping skills. In addition to medication and therapy, lifestyle modifications can also be helpful for managing ADHD symptoms. These modifications include regular exercise, a healthy diet, and adequate sleep. It is important to note that there is no cure for ADHD. However, with appropriate treatment and support, individuals with ADHD can learn to manage their symptoms and lead successful and fulfilling lives. Early intervention is crucial, as it can help children and adults with ADHD develop the skills they need to manage their symptoms and achieve their goals. In conclusion, ADHD is a neurodevelopmental disorder that affects a person's ability to pay attention, control impulsive behaviors, and regulate hyperactivity. It is characterized by three main symptoms: inattention, hyperactivity, and impulsivity. ADHD can have a significant impact on a person's life, but with appropriate treatment and support, individuals with ADHD can learn to manage their symptoms and lead successful lives. The exact cause of ADHD is not yet known, but genetics, environmental factors, and brain structure and function are all believed to play a role in the disorder. Diagnosis of ADHD usually occurs in childhood, but it can also be diagnosed in adults. There is a misconception that ADHD only affects children, but in reality, many adults also struggle with the disorder. In some cases, the symptoms may not have been properly diagnosed or managed in childhood, leading to ongoing difficulties in adulthood. ADHD can also develop later in life due to brain injury, stroke, or other medical conditions. Adults with ADHD may struggle with maintaining employment, relationships, and managing daily responsibilities. They may also experience feelings of low self-esteem, anxiety, and depression. It is important for adults with ADHD to seek proper diagnosis and treatment, as this can significantly improve their quality of life. There is still much research to be done on ADHD, but advances in understanding the disorder have led to improved diagnosis and treatment options. However, there is still a stigma surrounding ADHD, which can lead to individuals not seeking proper diagnosis and treatment. It is important to raise awareness about ADHD and promote understanding and support for individuals living with the disorder. Overall, ADHD is a complex disorder that can have a significant impact on a person's life. With appropriate treatment and support, individuals with ADHD can learn to manage their symptoms and lead fulfilling lives. It is important to continue researching the disorder and promoting awareness and understanding to improve outcomes for individuals with ADHD.